Hello, everyone. I'm John Riley with MTN. Right now, I'm joined with Jim Murphy, the Administrator of the Public Health and Safety Division with DPHHS. Jim, as I understand, we've got some new news regarding COVID variants tonight in Montana.
That's correct. We've been looking for some of the new variants that might be circulating in Montana for quite some time now, at least the last month or so. We've had our first variants of interest surface today. We have three variants that all look like they're the United Kingdom variation that have been confirmed now. They're all from the same area of Montana, out of Gallatin County. We're working with Gallatin County to find out a little bit more about these cases. What we know so far is that these folks were fairly young. All of them recovered. So no big concerns there. But this is our first indication that there's different variants that are circulating in Montana. We've tested about 185 samples, and these are the first three that we have found so far. We join about 45 other states that have found the UK variant. So not a unique thing, but at least our first ones.
Now, as for the variant, for public health perception, what are the concerns with the variant compared to the current pandemic that's going on?
I think with any new variant that pops up, there's going to be some concern to see if there's characteristics that make it more dangerous. Is it causing more severe illness? Is it more contagious or more transmissible? And then the big question right now with these variants that pop up is the vaccine going to be as effective against these? I think the good news right now is that the UK variant has been around a little while. We know a little bit more about it. It does not look like it causes more severe illness. There is some evidence that it might be slightly more contagious or transmissible. But we also have pretty good evidence that the vaccine addresses this variant fairly well. But this is something that we're going to continue to look for. There'll be other variants after this one. We'll see how this process goes, and we'll be able to spot concerns early, we hope, because we're expanding our work to do this.
And correct me if I'm wrong, Jim, but if the FDA did release statements regarding both the Pfizer, Moderna, and Johnson & Johnson vaccines concerning the UK variant.
Yes, early on there was concern that there might be some less efficacious performance of the vaccines with the UK variants. I don't think that has panned out, so some of the fears have not been realized there. There's other variants that are out there on the horizon too that they are concerned about. This is new. Each one's going to take more time. To see how this, impacts the pandemic. It's going to take more time to see how this impacts vaccine efforts. But right now, the best information we have is that the current vaccines that are in use do appear to do fairly well with the UK variant, preventing serious illness and preventing deaths.
Now, I would also be remiss not to ask you, what's the best way to keep this variant from spreading further or faster in Montana?
Well, I think the basic advice that we've been offering pretty much since April of 2020 still applies. Variants are a concern because the more virus that is transmitted in Montana, it's more likely that the variant will erupt. If there's more transmission going on, you end up with more variants. So anything we can do to minimize or lessen transmission is going to be important, not only to prevent the spread of the routine variants that are out there, but also to prevent the emergence of any variants of concern like this one. So keeping your distance, mask wearing is still strongly recommended. And the other thing that we're really encouraging nationwide is, when the vaccine becomes available to you, please take advantage of it. Because the more we can minimize the transmission or the acquisition of these viruses, the less likely it will be that new variants emerge. So kind of right now, we're racing against the virus itself, trying to suppress the emergence of these variants. The best way for us to do that is to minimize transmission, get vaccinated. Same things we've been urging for some time.
Well, thank you so much for your time today, Jim. If anybody has questions about COVID-19 or the potential variants, that information can be found on the DPHHS website under their COVID dashboard.